Okay, now let's talk about cardiac tumors. Cardiac tumors are most common cardiac tumor is a metastasis, meaning melanoma. So the most common is metastasis. Uh, let's talk about myxomas, right? They are the most common primary cardiac tumors in adults. Okay, what is myxoma? It's a benign mesenchymal tumor. It's a benign mesenchymal tumor. Okay, uh, it is seen in adults. Arrows in A, we can see myxoma right here. Okay, and 90% occurs in atria, as you can see right here. See here, it's in atria, mostly in the left atrium. Yes, it is in the left atrium. Myxomas are usually described as ball valve. Yeah, you can see that it's a ball like valve, a ball in a valve, right? Which causes obstruction in the left atrium associated with multiple syncopal episodes. Right. So it's going to cause syncope in an adult. Okay. There is IL-6 production high yield. This tumor, so this ball-like thing, B is ball, right? So B is also for like 6. So this ball produces IL-6, and that IL-6 causes constitutional symptoms, for example, fever, weight loss. May auscultate early diastolic tumor plop, early diastolic tumor plop sound, which mimics mitral stenosis. So it's going to have a murmur, which is going to mimic mitral stenosis murmur, which is a tumor plop sound. Histology is high yield. You will see gelatinous material, myxoma cells immersed in glycosaminoglycans. Adults make 6 mixed drinks. Adults for adults, 6 for IL-6, mixed for myxomatous material. And drinks because the adults drink. So I guess that's why. But here, the important thing is, again, it's going to be either the ball-like or pedunculated mass. That's one thing. Other than that, you are also going to think about, because it's going to obstruct the left atrium, it's going to give you mitral stenosis sign and symptoms. And mitral stenosis sign and symptoms being your syncopal episodes. Right? Decreasing a big wide syncopal episode because you're decreasing the cardiac output. And that is going to be there. And because it's a tumor, the fragments can embolize. Fragments may embolize, can cause what it, because it's in left atrium already, so it's going to cause systemic embolization. Or what are the systemic embolizations now? So if it goes to the brain, it's going to cause stroke. If it goes into the GI, it's going to cause mesenteric ischemia, right? And these are the things that it can cause. Other than that, it can also lead to obstructive sign and symptoms. Obstructive meaning because you're obstructing the blood flow, causing decrease in cardiac output. That's your obstructive sign and symptoms. Now let's look at the actual high yield point. That is going to be your IL-6. We talked about it. That's going to cause constitutional symptoms. On top of that, you would have increase in VEGF, vascular endothelial growth factor, which causes angiogenesis. So in these patients, there's going to be increased angiogenesis over there at the local tissue. Abnormal, again, what is angiogenesis? They won't say angiogenesis. Abnormal blood flow, abnormal blood vessels formation abnormal blood vessels, which leads to what? Well, because when you have abnormal blood vessels, it's going to cause hemorrhage. Hemorrhage, how's hemorrhage going to be seen as? Hemorrhage is going to be seen as RBCs and brown hemosiderin-laden macrophages. Brown pigment macrophages or brown hemosiderin-laden macrophages due to the fact that increase in VEGF. So there is a production of not IG6, but IL6 and VEGF, high yield VEGF for angiogenesis. Okay. And this gelatinous material, which are again myxoma cells, these same cells immersed in glycosaminoglycans, glycosaminoglycans, yeah. Here you will see on histology, they will not say all of this, but they will say amorphous extracellular matrix, amorphous extracellular matrix, which in other words simply means that there is gelatinous material with glycosaminoglycans. And what are the by the way, what are the glycosaminoglycans? These are your carnitine sulfate, hyaluronic acid, so HA, carnitine sulfate. Other name would be your mucopolysaccharides stroma. And that is going to be all for myxoma. Now let's look at the last one here. It's called rhabdomyoma. Let's change color. Rhabdomyomas. It is the most frequent primary cardiac tumor in children. So let's see the difference. We said that is adult, and this is children, associated with tuberous sclerosis. Histology is hematomatous growth. Most common in the ventricles. High yield. This was left atria, here the ventricle. That is an adult, here's a children. It is associated with tuberous sclerosis. That is associated with IL6, VEGF, and gelatinous material. And what else? Yeah, that's pretty much all we have. So let's just quickly review it. Cardiac tumors are more likely to be metastatic than the primary, but the primary ones are going to be myxoma and rhabdomyomas. For the myxoma, it is benign mesenchymal tumor seen in adults that would produce IL6 VEGF that would cause mitral stenosis type murmur. Left atrium will block, left atrium decrease in cardiac output causing simple episodes. And when you look at on histology, this thing will look as gelatinous material with glycosaminoglycans, again amorphous extracellular matrix. Okay, and with the rhabdomyomas, it is in children with associated tuberous sclerosis seen in ventricle. It is just a hematomatous growth, and that is all for cardiac tumors.